Salam sejahtera and a very good evening, ladies and gentlemen. First and foremost, I would like to thank BioLife for having me here this evening. And as what YB Lee Kim Shin had mentioned earlier, medicine is evolving very fast based on areas of evolution. Number one is the digital health. Number two, we talk about artificial intelligence going to change the way we practice medicine. Number three, robotics. You know, yesterday I saw even a professional cannot beat a robot playing pong. And robotic surgery, robotics in our healthcare is coming into the system that we have. And last but not least, we mentioned about biomedical technology. And this is one of the areas of biomedical technology. It is basically we are talking about regenerative medicine. So regenerative medicine is one component of biomedical technology.
Yeah, sure. 好，我们简短的帮丹水翻译一下。他刚刚提到的就是呢，在这个健康的领域呢，药物是日新月异的。接下来我们即将会见到的就是有很多 AI、很多的机器人、很多的生物科技的发展。Back to you, 丹水。
Yeah, so today we're going to talk about a bird's eye view of biomedical technology, and the other panelists will discuss detail about what we are doing and what changes are coming to play. So regenerative medicine and biotechnology, restoring health naturally so that we can live longer and healthier. That is what we aim for, to embrace this biotechnology. Regenerative medicine, basically it is repairing and replacing damaged cells, tissue and organ. Our body is already doing it. For example, going for surgery, your body heals, after the surgery. And this is our skin, for example, keep changing every 120 days. The new skin will be formed. But there's a balance between new production of the skin and the skin that has been replaced. So there's a strike of balance. But when there's a loss of the balance, more skins will be produced, then it becomes a tumor. And if that skin can spread, then it will become a cancer. So this is where we hope that we can strike that balance. And second is basically to restore the normal function, often utilizing some technique like stem cells, tissue engineering, and etc. This is also included under regenerative medicine, and stimulating the body's own repair to function and heal well previously unrepaired tissue. And one example is here, looking into a Japanese scientist have started testing a new drug that could regrow. Okay, so the Japanese scientists have tested a drug that can regrow the real teeth, offering a natural alternative to implant and dentures. Can you imagine now with one drug you can actually regrow your teeth? And this is the drug called TRG35 that blocks a protein known as USAG1, which normally stops the teeth from developing and growing. So this is a new area and more very exciting time for us to look into regenerative medicine.
没错了，刚刚提到的就是呢，再生医学呢，它不只是控制病情，它更像是希望帮助我们的身体来自我修复。那么用到的是有生物科技啦，可能有干细胞啦。譬如说，在日本目前有一种药物呢，可以让我们的身体自体的牙齿再生。
And regenerative medicine includes growing tissue and organ in the lab and implanting them when the body cannot heal itself. Not only your body can heal, but if your body cannot heal, we can actually grow the tissue in the lab and then use it. For example, skin, we can grow it in the lab and then use the skin to cover for the wound, etc. So this is avoid the tissue rejection when it comes from your own body. And second is stem cells, obtained via a directed differentiation cell therapy also can be used. And obviously the third is induced regeneration using biological active molecules, induce them, and then you can have immunomodulation therapy and to transplant the cells to the body. This is something that is coming, and we are exploring, evolving in terms of this technology to be applied in our healthcare system.
那么简单来说呢，再生医学有几个方向哦。第一个就是呢，他们可以在实验室里面培养我们需要的细胞跟组织。那么另外一个呢，就是用细胞来帮助修复。另外还有的就是呢，可以利用细胞来帮助身体释放一些可以修复病情跟身体的讯号。
Let's look back in the history. In the 19th century, what happened is you have a burn, for example, loss of skin. We do the skin grafting, taking skin from other parts of the body and then to graft in the area of damage. So, and then we move on to advances in organ transplantation. We can transplant organ from, for example, tissue engineering. Now we try to regenerate the organ, and cellular therapy led to stem cell research. Now, the first cell therapy were intended to slow down the aging process. In 1930, Paul Newhans injects cells of young animals into patients and then exploring the response. In 1956, they tried to treat leukemia by inserting bone marrow from a healthy person to a patient, identical twins. Then the rejection is less. If it's autologous, then the rejection will be there. For example, you have a kidney transplant from an identical twin, the rejection will be less. But if you get a kidney from other people, then your body tends to reject. So this is where, we started using autologous, but then you have to take medicine for the anti-rejection.
那么再生医学呢，如果用历史来看的话，19世纪就已经有皮肤移植了。那么之后呢，就有组织的移植、器官的移植都有。那么其中包括了就是1930年呢，曾经就是用动物的这个年轻动物的细胞注入病人的体内。56年的时候呢，骨髓移植呢帮助了白血病。所以呢，再生医学呢，不只是它已经不是一个新的概念了，是一直在进步的生物工程。
So in 1992, a new branch of medicine that attempts to change the course of chronic disease, regenerate failing organs, already been established. In 1999, restore to normal function that which is damaged by the disease, trauma, or worn out with time. So the technology is being used. And from 1995 to 1998, human embryonic stem cells and human embryonic germ cells has been discovered, and in year 2000 stem cell therapies and multiple research has been done, and this is where I think using pluripotent stem cells or even induced pluripotent stem cells have actually differentiated to other tissues, all have been explored. And more important, the application of this knowledge on regenerative medicine to treat patients as well as to make sure that increase the lifespan of our patient as well.
好，那么92年、99、95到98跟2000年呢，都有很多再生医学的案例跟成功的例子哦。那么其中有包括了就是创伤啦、老化啦等等。那么简单的来说呢，刚刚丹旭想要提到的就是这个再生医学，它已经慢慢的在改变所谓的慢性病啦、器官衰竭，还有老化的过程了，都在进步当中。
As YB mentioned just now, can we live into 120 years or not? You look into the data that we have. In 1950s, our age, lifespan is only 50 years old. And then with the improvement of healthcare and all the challenges that we have managing infectious diseases and also non-infectious diseases, you can see the improvement in 2023, our lifespan almost 80 years old. But with this biomedical technology, I believe lifespan will continue to increase, maybe at least 100 years, and it's not possible, it's not impossible for us to achieve 120 years. Now, healthcare has been, lifespan has been increased because of better healthcare. Access to the hospital, clinic, and the medical professional has improved in terms of to prevent infectious diseases. And second is clean water. Clean water is very important, the first important public health measures to improve lifespan. Second is the vaccination in terms of to prevent infectious diseases and etc. And obviously the third component is economic development. Economic growth has led to better jobs, income, and access to healthcare, whether it's a public sector or private sector. But more important, we do not emphasize this enough, is the nutrition of the population. So this has actually impacted in our increased lifespan until 80 years old, 78 to 80 years old. And the government health initiative, the public campaign, maternal and child health, and the national health insurance, this impacted in terms of how we can access affordable healthcare system, and our lifespan have increased. But if you look into the expectancy here in other countries, similarly, because from 1950s, 1960s, and then to recently, most countries can achieve a good healthcare lifespan almost 80 to 90. But because of the biomedical technology, regenerative medicine is coming into life, and we believe that it can increase. So, but the challenge today is not only infectious diseases like COVID-19 or other infectious diseases, antivirus and etc. But it's equally important is a non-communicable diseases that we are facing. This is a sedentary lifestyle, for example, diabetes, hypertension, and etc. So you can see from 1990 to 2021, this is certainly increasing, and this is our concern because non-communicable diseases is a real challenge for our country to overcome. And you look into our data, diabetes, 1 in every 6 Malaysian more than 18 years old have diabetes. Hypertension, 1 in 3, 30% of us have hypertension. And hypercholesterolemia, 3 out of 10 more than 80 years old have high cholesterol. And inadequate dietary intake, you can see 9 out of 10 Malaysian consumed inadequate amount of daily recommended fruit and vegetables. And this is why you can see obesity, overweight is highest, one of the highest in Southeast Asia is Malaysia. And physically non-active, for example. So these are all the indicators to show us that if we cannot tackle this, it's very difficult for us to live more than 100 years old. And this is the challenge that we have, and we hope that we are able to tackle not only infectious diseases, but also non-infectious diseases. And the lifespan and health span, the musculoskeletal disease like osteoarthritis are the second leading cause of disability. When you retired, if you are not able to move, mobilize, then I think they will impact on your lifestyle and etc. So osteoarthritis is, for example, is very important for us to make sure that we can ambulate and continue to mobilize. Now you can see the progression of osteoarthritis from mild pain 1 or 2 years to a chronic pain in 6 to 10 years. And this is a very challenging if we want to continue to prolong our life, increase our lifespan.
好，简单跟大家来说明一下。那么其实我们平均年龄1950年是50多岁，到2023年，其实呢平均年龄已经到达了80多岁。当然呢，借着我们现在的再生医学、生物科技等等呢，我们的平均年龄会继续的进步，继续的增长。然后非常值得跟大家分享的就是，刚刚丹旭有说到，在马来西亚，6个人里面有1个有高血糖还是糖尿病，3个里面有1个高血压，那么10个里面呢有3个人就是有胆固醇过高的问题，10个马来西亚人就9个营养不均衡，所以我们才是东南亚最肥胖的国家。那么当然呢，除了就是要长寿之外呢，行动还有我们肌肉骨骼的力量也非常的重要，所以再生医学在这一个部分呢，就起了一个很重要的责任。
So 1 in 4 Malaysian have 55 years and above have osteoarthritis, and when you are 65 and above, 2 out of 5 have a knee problem. So mobilization is very important, and therefore now we look into in terms of regenerative medicine, mesenchymal stromal cell, for example. How can it support in terms of regeneration of the new cells in the knee, reduce the inflammation and promote the cartilage from remodeling? So I think this is where we talk about cells review. For example, how can we actually manage and treat osteoarthritis so that we can actually increase our lifespan?
好，刚刚有提到的就是呢，在马来西亚超过55岁的朋友，4个里面呢，有其中1个呢都会有肌肉还是骨骼相关的疾病。那么5个里面呢，有2个关节，尤其是膝盖都会出现问题。所以刚刚丹旭提到的就是呢，再生医学对我们的膝盖骨骼的部分呢，起到最棒的其中一个例子，就是可以让我们的软骨组织再生、恢复行动力。Back to you.
So I'm not going to go to detail, but this is just a review of the cell cycle in terms of how we look into cells, and from cells, DNA to cells, then from cells become tissue, tissue become organ, and organ become organism. And this is where I think if we can actually increase and manage the DNA, the cells, the tissue and organ, then I believe we can increase the lifespan of us. So in a single day, for example, we lose and replace about 50 to 70 billion cells, like a skin, for example, losing and all that. But we hope that we can actually have technology to regenerate. This is where stem cells comes in. And today, I think stem cells have 2 types. One, they can self-renew. And second, is that not only renewed, they can differentiate to other cells. The skin, the bone, and etc. So in a while's time, the other panelists will discuss detail about stem cells, application of stem cells, how to regrow the cells, and etc. I'm running out of time. So what do stem cells do? Basically, their job is looking into how to regenerate the cells in our body. This is one example. The normal response if we have a wound injury or after surgery. First, the clot formation. Second, there will be inflammation attracting all cells. And the third, proliferation and then remodeling. Now, this is a normal process. How can we actually alter this process to respond better, faster, and to heal better in terms of wound? And this is something that we can look into it, and how we can remodel our health using regenerative medicine.
没错了，我们每一天呢都会失去大概500亿到700亿个细胞那么多，所以呢，自体修复呢是非常非常的重要的。所以再生医学在这个部分呢起到很重要的角色，就可以让我们的皮肤伤口修复得更加的快。干细胞呢就是其中一个最重要的生长基础啦。
So we look into in terms of regrow the cartilage in the bone, especially the knee, the new hair cells, the heart muscle, damage to the intestine, and etc. So we can use this technology to regrow the regenerate cells in our body.
没错，可以在我们 身体的每一个部分呢，都可以用再生医学来再生细胞，进而做到修复啊。其中包括的就是有软骨组织啦，包括我们的这个头发啦等等，再生医学的科技都可以做得到。
Now the thing where many different sources of stem cells. So from our body, yes, you can actually harvest from our body, or you can have induced pluripotent stem cells. That means the cells can differentiate. You induce it and differentiate to becomes an organ, for example. So, or you can use embryonic stem cell or mesenchymal stem cell. For example, we mentioned about the teeth. You can actually induce with drugs and then stimulate the teeth to grow. So this is something that the technology is there. We will hear from our other speakers with regards to the application of these stem cells. So I think this probably will be my last slide. So the details of in terms of application of the mesenchymal stem cell or the embryonic stem cell or the induced pluripotent stem cells will be elaborated, and we will share with you what we have today and what we expect to gain in time to come. This is a very exciting time for us to look into the application of regenerative medicine to prolong our lifespan. Over to you.
没错啦，那刚刚有提到的就是呢，其实干细胞可以来自自己的身体，也可以来自其他人，但是来自其他人呢，可能会出现一些排斥的问题。那么接下来呢，在这个画面上看到的就是一个叫做间充质基质细胞 MSC。那么接下来呢，我们会透过每一个演讲人的这个讨论当中，更加了解到这个 MSC 呢，其实呢，它可能会是一个万能细胞。我们待会儿会继续的细聊。
Right, since the time is running out, I will end my presentation here, and I hope our other panelists will continue to explain the details of the mesenchymal stem cells as well as induced pluripotent stem cells or even embryonic stem cells. Thank you.